Good morning, and let me welcome you to a conversation that might completely shatter and reconstruct everything you think you know about the next chapter of your life, or the life of someone you would do absolutely anything to protect. If you are standing at the crossroads of aging, or if you are an adult child watching your vibrant, intelligent parents face the slow, creeping vulnerabilities of getting older, you have likely been told a massive, systemic lie. You have been told that when living completely alone starts to feel like too much, your choices are binary. You either struggle in dangerous isolation or you surrender to an institutional nursing home. Today, I am here to tell you, as a physician who has spent over 2 decades on the front lines of geriatric medicine, that this binary is completely false, and the standard institutional route might actually be the single worst decision you could ever make. My name is Dr. Harold Meyers, and over the course of my career, I have watched too many incredible, capable, fiercely independent people essentially disappear into institutional care long before they ever needed to, simply because they and their families didn't know there was another way. The modern senior care industry is a multi-billion-dollar machine that thrives on a lack of information, pushing a narrative that once a senior experiences mobility issues, early-stage memory changes, or difficulty maintaining a household, their independence is officially over. But the cutting-edge science of longevity and gerontology tells a completely different story. Before we look at the revolutionary models that are outperforming traditional nursing homes across every measurable medical metric, I want to share a piece of data that completely stopped me cold when it was first published, and it should change how you view this entire issue. A landmark longitudinal study funded by the National Institute on Aging meticulously followed over 4,800 older adults across a 12-year period. What they discovered should have been front-page news globally. Seniors who remained in community-based or home-centered care settings showed a staggering 43% lower rate of cognitive decline compared to those placed in traditional institutional nursing homes. Let that number sink in for a moment. 43%. That is not a minor statistical variance, that is nearly half. When the researchers dug into the data to find out exactly why staying out of an institution had such a profound protective effect on the human brain, they identified a single, overriding factor that mattered more than almost anything else: social autonomy. The simple, everyday feeling of being in total control of your own life, your own schedule, your own front door, and your own environment is the single strongest neurological shield we have against both mental and physical deterioration in adults over the age of 70. Now, I want you to stay with me for this entire breakdown, because the number one alternative on our countdown today is something so revolutionary, yet so brilliantly simple, that most people have never heard of it, even though it has been quietly helping seniors with early-stage dementia, severe mobility issues, and profound isolation remain completely independent for an average of 7 additional years beyond what traditional medical models predicted. 7 extra years of sleeping in your own bed, eating your own food, and living life on your own terms, all at a tiny fraction of the exorbitant cost of an institutional facility. If you stay until the end of this video, I promise you that this single model could fundamentally change the trajectory of your family's future. But before we count down from 5 to our number 1 spot, I want to ask you to engage with me directly. Drop a comment below right now and tell me your age or the age of the loved one you are caring for, and let me know if you are currently navigating this exact emotional and medical minefield. What do you do when living entirely alone feels like it's becoming unsafe, but a nursing home feels like a prison sentence? I read every single comment on this channel personally because your real-world stories are exactly what drive the scientific research I bring to light here every single week. Let us begin our countdown at number 5 with an option that is frequently misunderstood and tragically underutilized because people are stuck with an outdated picture of what it actually is. We are talking about adult day health programs, but specifically those operating under the highly sophisticated PACE model, which stands for the Program of All-Inclusive Care for the Elderly. When most people hear the words Adult Day Program, they immediately picture a depressing, sterile community room with a television blaring too loud, a few folding chairs, and a group of seniors looking entirely disengaged. That image is completely obsolete, and clinging to it is actively costing seniors their physical health and mental clarity. Modern adult day health programs are highly sophisticated clinical and social environments designed to act as an all-inclusive medical home. The magic of this model is that it allows you to keep your life exactly as it is. You sleep in your own bed every night. You keep your beloved pets. You maintain your exact morning and evening routines. But during the day, you are transported to a state-of-the-art facility where you receive comprehensive nursing care, intensive physical therapy, specialized occupational therapy, hot nutritional meals, and direct physician oversight, all managed under one single roof. The data supporting this model is overwhelming. Researchers at Johns Hopkins University conducted a massive study tracking over 2,200 PACE participants across a 5-year window. Their findings were revolutionary. Seniors enrolled in these programs were 74% less likely to be admitted to a permanent nursing home compared to similarly situated seniors who didn't have access to the program. Furthermore, their emergency hospitalization rates plummeted by nearly a third within the first 18 months of enrollment. To understand why this works so profoundly from a medical standpoint, we have to look at what geriatricians call the deconditioning spiral. After the age of 65, the human body behaves much like a high-performance vehicle that only runs well if it is driven regularly every single day. The very moment an older adult stops moving purposefully, stops engaging socially, and stops being actively challenged mentally, every physiological system begins to deteriorate at an accelerated velocity. The musculoskeletal system rapidly sheds muscle mass and bone density, the cardiovascular system loses its adaptive efficiency, and the brain, starved of rich social stimulation, begins aggressively pruning neural connections it falsely assumes are no longer needed. An adult day health program forcefully interrupts that destructive spiral by introducing structured, engaging physical and mental activity into the senior's weekly routine. But there is another side to this medical equation that we must talk about honestly: the family caregiver. Caregiver burnout is not just an emotional state, it is a profound medical crisis. Extensive epidemiological studies show that full-time family caregivers who are handling the immense stress of an aging relative entirely on their own have a 63% higher mortality rate than non-caregivers of the exact same age. The chronic, unremitting stress floods the caregiver's body with cortisol, destroying their own immune system and cardiovascular health. Utilizing a modern adult day health program is not an admission of defeat or a selfish compromise. It is a clinical upgrade for the entire family ecosystem. It provides the caregiver with the essential breathing room to work, rest, and tend to their own health, while ensuring the senior is receiving top-tier, multidisciplinary professional care. If you want to find these programs near you, you can use the official PACE Finder tool on Medicare.gov, which allows you to search entirely by zip code. Most of these programs are fully covered by Medicare and Medicaid for eligible seniors, and many offer sliding scale fees based on income. I remember a patient of mine named Margaret, a fiercely proud 78-year-old woman who had lived a vibrant life, but was starting to suffer from poorly controlled hypertension, recurrent falls, and the early disorienting signs of vascular dementia. Her daughter had stepped up to be her full-time caregiver, but after 2 years of constant vigilance, both women were utterly depleted, physically and emotionally. Margaret was withdrawing into silence, and her daughter was on the verge of a medical breakdown. We stepped in and enrolled Margaret in a local PACE Adult Day program 3 days a week. Within 8 months, the transformation was nothing short of miraculous. Because a physical therapist was working with her dynamically every week, Margaret's balance improved so much that she didn't experience a single fall. Her medications were managed daily by the on-site clinical team, stabilizing her blood pressure completely. But the most profound change wasn't recorded on a medical chart. Her daughter came into my clinic, looked at me with tears in her eyes, and said, "Dr. Meyers, my mother is laughing again." That is what happens when you rescue someone from isolation and the deconditioning spiral. Moving to number 4 on our list, we find an option that has been completely revolutionized by modern technology over the last decade, making it accessible to virtually every senior in the country, no matter how rural or isolated their home might be. We are talking about the strategic combination of advanced home health care paired with remote patient monitoring, a clinical setup that modern medical researchers are now calling the hospital without walls. Imagine a system where you do not have to move into a facility to get clinical oversight because the technology and the staff come directly to you. A certified home health aide or a registered nurse visits your home anywhere from a few times a week to daily, assisting with highly skilled needs like medication management, complex wound care, physical therapy exercises, and comprehensive health assessments. But the true game changer is what happens during the 23 hours of the day when the nurse is not there. Small, highly accurate wireless devices are integrated into your home ecosystem. A blood pressure cuff that transmits its data automatically via the cloud the moment it is used, a continuous pulse oximeter, an advanced ambient fall detection sensor that doesn't require a wearable button, and even a smart weight scale that tracks minute changes in fluid retention. All of this data flows in real time to a centralized clinical monitoring team. If your oxygen saturation dips slightly below your personal baseline, or if your weight spikes due to fluid retention from heart failure, a clinician calls your phone immediately to adjust your medication before you even realize a medical crisis is brewing. The clinical proof for this model is exceptionally robust. A major study published in the Journal of the American Geriatric Society revealed that seniors receiving high-tech home health care combined with remote monitoring experienced a 38% reduction in emergency room visits and a 29% reduction in preventable hospital readmissions. Even more astounding was a targeted analysis from the Cleveland Clinic focusing on patients with congestive heart failure, which is historically one of the primary medical diagnoses that forces older adults into permanent nursing home placements. For these patients, the implementation of remote patient monitoring slashed 30-day hospital readmissions by an incredible 52%. To truly understand why staying inside your own home is so medically protective, we have to look at a severe psychological and physiological phenomenon known as transfer trauma. Transfer trauma is one of the darkest, most well-documented secrets in geriatric medicine. When an older adult, particularly one over the age of 75, is suddenly uprooted from a highly familiar home environment and placed into an unfamiliar, regimented institutional setting, the body reacts with a profound systemic shock response. Their natural sleep architecture completely collapses, their nutritional appetite drops off a cliff, and their overall immune function becomes severely suppressed due to elevated stress hormones. The aging brain relies heavily on environmental familiarity, things like knowing exactly where the bathroom light switch is or the familiar creak of a floorboard to compensate for early, subtle cognitive changes. When you remove those familiar spatial cues, the brain becomes profoundly disoriented. Studies show that up to 30% of seniors experience a measurable, permanent decline in cognitive functioning within just 60 days of being moved into an institutional setting, even when the move itself was deemed medically appropriate. Home health care paired with remote monitoring completely eliminates transfer trauma. You remain in your sacred space, surrounded by your lifelong possessions, sleeping in your own bed, and eating food you recognize, while receiving a level of medical oversight that can manage complex chronic conditions just as effectively as a facility. The practical way to initiate this is through a direct physician's referral. Medicare Part A covers home health services completely when a doctor certifies that they are medically necessary and that the patient has functional limitations that make leaving the home difficult. The eligibility criteria are actually much broader than most families realize. If you have recently been hospitalized, if you are managing a changing chronic condition like diabetes or COPD, or if you have had a recent change in your mobility, you likely qualify. You need to look your primary care doctor in the eye at your next appointment and ask the specific question: am I eligible for skilled home health services under Medicare? I often think of a patient named Robert, an 81-year-old retired mechanic from Baton Rouge, Louisiana, who was suffering from advanced chronic obstructive pulmonary disease. His pulmonologist had told his family that his oxygen requirements were becoming too difficult to manage safely at home and that they needed to start touring long-term care facilities. Robert was devastated. He told his son he would rather pass away than go into a home. We rejected the facility option and instead set him up with a specialized home health program equipped with remote oxygen and biometric monitoring. We placed a cellular-enabled oximeter in his home that tracked his levels continuously. Within 4 months of setting up this hospital without walls, his acute flare-up rate dropped by half because we were catching and treating early bronchial infections the moment his oxygen data trended downward, days before he felt short of breath. He was able to sleep peacefully in his own room, eat his wife's cooking, and watch his favorite football teams from the comfort of his own recliner. Robert passed away 2 years later, but he passed away at home, in his own space, with his dignity completely intact, exactly the way he wanted. Before we move into our top 3 options, which is where the alternatives become truly mind-shifting, I want to take a brief moment to speak to you directly. If this video is giving you actionable information that you have never heard from your standard doctor's visits, please take a moment to subscribe to this channel and hit that like button. I release deep dive, science-backed content every single week specifically for families navigating the complex, emotional, and practical realities of aging. I don't do fluff and I don't do generic advice. I provide the hard medical science and practical roadmaps that your busy doctors simply do not have the time to explain to you during a 15-minute clinic visit. Subscribe now so you never miss these vital updates, because the information we are about to cover next is exactly what thousands of seniors say they wish they had known years before a crisis ever occurred. Coming in at number 3 on our countdown is a model that has been quietly revolutionizing the entire concept of senior care across Scandinavia, the Netherlands, and Japan for more than 20 years, and it is finally gaining massive, unstoppable momentum right here in the United States. We are talking about intentional senior co-housing communities, and the longitudinal health data behind them is nothing short of staggering. Let me be unequivocally clear. Co-housing is not assisted living. It is not a retirement village in the traditional corporate sense, and it looks absolutely nothing like a nursing home. Co-housing is an intentional housing model where a small, cohesive group of older adults, typically spanning between 8 and 30 individual households, collaboratively design and manage a shared living environment. In this setup, every single person or couple owns or rents their own fully independent private home or apartment, complete with their own kitchen, living room, and front door. You have total privacy and total autonomy. However, these private residences are purposely clustered around a beautiful, highly functional common house that features a massive chef's kitchen, large dining areas, vibrant gardens, fitness spaces, and creative workshops. In a senior co-housing community, neighbors aren't just people who happen to live next to you. They are an intentional network of mutual support. Residents share gourmet meals a few times a week by choice. They work in the gardens together, and they look out for one another with structured intention. If someone has a doctor's appointment, a neighbor drives them. If someone is an expert gardener, they manage the landscaping. If another resident is a retired nurse, they might help neighbors decipher complex medical jargon or medication changes. It is a modern, self-governing return to the traditional village concept. The medical data tracking this lifestyle is profound. A massive 15-year longitudinal study conducted by the Danish Institute for Local and Regional Government Research followed over 1,400 seniors living in these co-housing arrangements. When compared to age-matched peers living in conventional isolated suburban housing, the co-housing residents exhibited a 35% lower rate of clinical depression, a 28% lower rate of emergency hospitalizations, and they lived an average of 2.4 years longer. Think about that for a moment. You can add nearly 2.5 years of high-quality life to your lifespan simply by intentionally changing the way you choose your neighbors and your physical environment. The biological mechanism driving these extraordinary health outcomes is deeply rooted in what social isolation does to the human body at a cellular level. Renowned researchers at Brigham Young University conducted a sweeping meta-analysis of 148 independent studies involving more than 300,000 participants. Their conclusion was definitive. Chronic social isolation increases an individual's mortality risk by 29%, a physical toll that is biologically equivalent to smoking 15 cigarettes every single day. As we cross the threshold of 70, isolation often becomes the default unintentional reality for millions of seniors as spouses pass away, driving becomes restricted, and children move away for career opportunities. Co-housing is a brilliant structural solution to what is ultimately a structural problem. To understand why this matters to your health, think of your immune system after 70 like a local fire station that is dealing with a steadily shrinking crew. Daily, spontaneous, meaningful human contact is one of the only natural forces discovered that keeps that internal crew fully staffed, alert, and functional. When an older adult becomes profoundly isolated, that immune crew dwindles, and systemic inflammatory markers begin to skyrocket throughout the bloodstream. Levels of C-reactive protein, interleukin-6, and tumor necrosis factor become chronically elevated. This constant state of low-grade chronic inflammation acts like acid on the cardiovascular system, rapidly accelerating the progression of heart disease, driving cognitive decline, and weakening the body's natural defenses against cancer. Co-housing completely suppresses this destructive inflammatory response naturally, not through an expensive pharmaceutical drug, but by structurally weaving daily, joyful human interaction back into the fabric of everyday life. In the United States, organizations like the Co-housing Association of America and the Elder Co-housing Network maintain comprehensive national directories of both fully established and currently forming communities. These communities are incredibly diverse. Some are entirely secular, some are faith-based, some are explicitly LGBTQ affirming, and others are organized around specific shared passions like environmental sustainability, classical music, or farming. The underlying financial structures vary as well, with some operating as standard real estate purchases and others as accessible cooperatives or rentals. However, virtually all of them cost significantly less than the monthly fees of a corporate assisted living facility while delivering vastly superior cognitive and physical health outcomes. I want you to visualize a real patient of mine named Eleanor, a 74-year-old former school teacher from Burlington, Vermont. After her husband of 50 years passed away, Eleanor found herself entirely alone in a large, drafty, multi-level home. Over the span of 3 years, she began quietly and dangerously withdrawing from the world. She was skipping meals because cooking for one felt pointless. Her sleep patterns disintegrated, and she began routinely canceling her vital medical checkups because the effort to leave the house felt too overwhelming. Her daughter, living 4 states away, was paralyzed with fear and constant anxiety. After an extensive family discussion, Eleanor made the courageous decision to sell her home and move into a newly forming senior co-housing community. Within 18 months, she was a completely transformed human being. Today, Eleanor actively coordinates a weekly community dinner for 14 of her neighbors. She has lost 11 pounds of unhealthy fluid and weight without even trying, and her systemic blood pressure numbers have improved so drastically that I was able to safely cut her cardiovascular medication dosages in half. She looked at me during her last annual exam and said something that will stay with me for the rest of my medical career. Dr. Meyers, I didn't even know I was drowning until someone threw me a rope. Now let us step into the number 2 spot on our countdown, an option that consistently surprises families the most. It surprises people because it takes a living arrangement that many modern families mistakenly view as an overwhelming emotional or financial burden and turns it into one of the most potent, scientifically validated health interventions in all of modern geriatric medicine. We are talking about structured, intentional, multi-generational living. This is the purposeful design of a shared living ecosystem where seniors live in close, structured proximity with their adult children and grandchildren. I know exactly what objections might be rising in your mind right now. You are likely thinking about a total loss of personal privacy, cramped bedrooms, constant noise, and the inevitable emotional friction that can occur when family dynamics are compressed under one roof. Those concerns are entirely valid and real. Poorly planned, reactive, multi-generational living, where a senior moves into a spare bedroom out of a sudden crisis, can absolutely create massive, unsustainable stress for everyone involved. But the absolute key word here is structured. When a multi-generational living arrangement is built intentionally from the ground up, featuring clear spatial boundaries, appropriate physical architectural modifications to the home, dedicated caregiver respite resources, and integrated professional support services, the clinical outcomes for the senior are among the absolute best documented in the entire history of gerontology. A landmark longitudinal study published in the prestigious journal The Gerontologist followed over 3,100 older adults living in highly structured multi-generational homes over an 8-year timeframe. The data they uncovered was staggering. Compared to seniors of the exact same age and health profile who lived entirely alone, seniors in structured multi-generational settings showed a 41% reduction in clinical depressive symptoms, a 47% lower rate of eventual nursing home placement, and an incredible 33% reduction in falls requiring medical attention.